Okay, let's dive right in. We're talking about what's essentially a brand new playbook for one of the most common and scariest neurological emergencies out there, the epileptic seizure. And this isn't just some academic paper. It's a huge new consensus from medical experts in Spain, and it's designed to standardize care and, ultimately save brains.
Just let that number sink in for a minute. 1 in 10. That's how many people the World Health Organization figures will have an epileptic seizure at some point in their life. So yeah, figuring out the absolute best way to respond isn't just a clinical debate, it's a massive public health issue.
You've definitely heard this before, probably for strokes, right? Well, it is just as critical, if not more so, right here. The science is crystal clear. The longer a seizure goes on, the worse the outcome. Every single minute that ticks by without treatment raises the risk of permanent neurological damage. It's a race against the clock. So if time is everything, you'd assume there's a clear step-by-step protocol that everyone follows, right? From the paramedics to the ER docs. Well, turns out that's been the big problem. Care has been all over the place, different from one hospital to the next, with no single unified plan for those critical first moments.
So, to fix this mess, this team in Spain decided to step up. They brought together some of the top minds from different medical fields to comb through all the evidence and literally build a new, standardized playbook for everybody, from the first responder on the scene all the way to the specialist in the hospital.
And what makes this whole thing so powerful is who was in the room. This wasn't just neurologists talking to other neurologists. They brought in emergency medicine specialists, the people on the front lines. That means the final plan isn't just smart, it's practical. It's built for the real-world chaos of an emergency. Now, their first move was maybe the most brilliant. It wasn't about a fancy new drug or some high-tech machine. It was about fundamentally changing how we even think about a seizure emergency. They came up with a whole new concept to shift care from being reactive to being proactive. And here it is. They're calling it an urgent epileptic seizure. The idea behind this new term is actually pretty simple. It's a trigger. It's meant to kick off a high-priority emergency response before a seizure spirals out of control. It's all about spotting the risk early and acting fast, instead of waiting for the absolute worst to happen. So this new, broader definition of urgent covers 3 main situations. First, you've got the obvious one, status epilepticus, when a seizure just won't stop. But, and this is so important, it also includes 2 other scenarios. Cumulative seizures, which are like a giant warning sign that things are about to get bad, and high-risk seizures, where something about the patient's situation means that any seizure is a potential catastrophe. Okay, so we've redefined the problem. Now let's get into the solution. Let's look at the actual treatment plan and see how it creates a super clear step-by-step response for the medical teams. The playbook itself is broken down into 3 logical phases. Phase 1 is all about one thing: stop the seizure now with fast-acting benzodiazepines. Phase 2 is about making sure it doesn't come back, using a second-line anti-epileptic drug. And Phase 3? That's the last resort, the plan for the toughest cases that don't respond to anything else. And you can see just how practical this plan is right here. It gives clear instructions for different real-world situations. If you've got an IV line in, great, diazepam is the answer. But, and this is huge for paramedics, if you can't get an IV started, you don't waste time. You immediately go to an injection or a nasal spray. No delay. Now, in that second phase, preventing another seizure, the choice of drug really depends on the patient. For years, this old drug phenytoin was the standard, but it can be tricky to use. Now the consensus is shifting towards newer, safer drugs like levetiracetam, which is especially great because it's so safe you could even give it before you have the patient's full medical history. Okay, all of this, the new definition, the phase treatment, it all leads up to the single biggest proposal in the entire document. It's a system-wide change inspired by other medical emergencies designed to bake this speed and efficiency right into the hospital's DNA. So you've got this smarter definition and a clear plan, but how do you make absolutely sure that it gets executed perfectly without any delays for every single patient, every single time they come through those emergency room doors? The answer is a seizure code. Think of it just like a stroke code or a code blue. It's a hospital-wide alert. The second it's activated, it mobilizes a dedicated team. ER docs, neurologists, nurses, and gets them to the patient's bedside immediately, skipping the usual wait times. And what triggers the code? Well, it goes right back to that proactive new definition. It's not just for people who are already in the worst-case scenario. It's designed to be activated for any urgent epileptic seizure. It's about using the hospital's full power to prevent a disaster, not just react to one. So the ultimate goal here, the big picture, is to create this perfect, unbroken chain of expert care. It makes sure that the clock starts the second that 911 call is made, and that every single action from that point forward is part of one coordinated, efficient, brain-saving mission.
Which kind of leaves us with one final really important question. This whole framework was developed in Spain, right? But the principles behind it, they're universal. It makes you wonder, and it's a question for healthcare systems everywhere. By thinking differently about the emergency and by creating a dedicated response, could a seizure code save brains in your community too?